So we record these events so that everybody who RSVP'd can get the information whether or not they were able to attend. And so that we put this up on our YouTube channel so anybody and everybody can tap into this information. So thank you for being at this public event and being willing to be recorded. I am thrilled to invite you guys here, whether you joined us yesterday or today's your first panel of the week. Welcome to another important discussion around affordable housing. This is Pierce County Affordable Housing Week, all week long. It's our second annual Affordable Housing Week and the first year that we're undertaking all of these events and public education and networking and community events around housing and intersectionality. So today's discussion is titled Healthy Homes, Healthy Communities. It's the intersection of housing and public health. So we're going to be exploring how safe, affordable housing is not merely a shelter, but a critical determinant of public health as well. We are excited to have some sponsors for this event. Sponsors are SMR Architects and Foster Garvey Law Firm. And we'd like to extend a special thank you to our title sponsor, U.S. Bank. I would like to start with the land acknowledgement. We gratefully honor and acknowledge that we rest on the traditional lands of the Puyallup people. The Puyallup people have lived on this land since the beginning of time. They are still here today. They live, work, raise their children, take care of their community, and continue to practice their traditional ways. We recognize that this land acknowledgement is one small step to true allyship, and we commit to uplifting the voices, experiences, and histories of the Indigenous people of this land and beyond. We want to acknowledge the histories and dispossession and forced removal and reflect on this history in ways that honor the memory of those dispossessed and keep us committed to the cause of social justice for Indigenous populations. So this event is one of many virtual events and in-person events happening this week as part of Affordable Housing Week. I encourage you to join us for other events. I'm going to throw a couple of these links in the chat. You can look at all of the Affordable Housing Week events going on through our website. The link is in the chat there. And today's event is going to be a panel style discussion. First, I'm going to briefly introduce who we have on our incredible panel today, and then let each of them have about 15 minutes or so to speak. That'll be a combination of some of the panelists having presentation slides for you and some of the panelists having me prompt them with questions. So hopefully it'll encourage a little bit of engagement and discussion. After each panelist has had time to speak, after their 15 or so minutes is up, we will, after everybody has gone, have time for discussion and additional questions from the audience. So feel free to throw your questions in the chat at that time, raise your hand, and you can take yourself off mute to ask your question. And quickly, before we dive into the conversation with our esteemed panelists, I'd like to take a moment to introduce myself and the organization that's putting on this event. So my name is Casey Twiggs, and I'm the membership coordinator for the Affordable Housing Consortium, and I'm thrilled to be your host. We are a nonprofit, membership-based organization that provides public education, advocacy, and support for the expansion of affordable housing throughout Pierce County. One way that we do this is by educating the public on the need for affordable housing by hosting virtual discussions such as this, public meetings, collecting data to share with the public on housing needs and local policy. And we also advocate at the state and local levels for funding that support the creation of more affordable housing, and as well as bolster the work of our members. So our consortium is committed to advocating and supporting the expansion of affordable housing. So with about 50 dedicated members ranging from housing developers to individual advocates, our organization tirelessly works to foster communities where everyone has access to safe and affordable homes. So for our topic today, access to quality housing is one of the most significant factors affecting public health. Housing instability, substandard living conditions, and overcrowding can lead to serious health challenges from respiratory disease to chronic stress. In Pierce County, 52% of renter households are cost burdened, paying more than 30% of their income on housing, which often forces them into inadequate living conditions. The health implications are staggering. Homeless children are more dependent on emergency services due to the lack of regular health care. And approximately 47% of homes in Washington were built before 1978, posing risks such as lead-based paint, and about 14% of those estimated to contain lead hazards. Also, in 2020, unintentional falls caused roughly 1,075 deaths around Washingtonians aging 65 and older. And additionally, BIPOC individuals in Washington are disproportionately affected by asthma, reflecting broader health disparities influenced by housing quality. So today our discussion will not only highlight these issues, but also discuss strategic investments in housing to improve outcomes in health, reduce healthcare costs, and promote overall well-being in our communities. And we look forward to an engaging panel that's going to help us better understand and address the critical intersection of housing and public health. So without further ado, let me introduce our expert panelists who will help us dive deeper into these topics. First, we're going to have Rob Olsen, Environmental Health Specialist Supervisor at the Tacoma-Pierce County Health Department. Rihanna Betancourt is going to be here to assist him in that information. Gabe Ash, the Director of Housing and Homelessness for Housing and Homeless Services for Catholic Community Services. And we also have Tonia Hess, Director of Housing and Care Management at the Metropolitan Development Center, joined by Victoria Chittenden. So we're going to start with you, Rob. If you're wanting to share your screen, go ahead. I will stop sharing mine so that you may do so.
Hi, everybody. Rob Olsen, Tacoma-Pierce County Health Department. I'm an Environmental Health Specialist Supervisor here. Let me make sure my screen is being shared. Looks like it is. Do you see a graphic up there?
You sure do.
Great.
Looks great.
All right. Great. Well, first, let me say, Casey and Amanda from Affordable Housing Consortium, thanks for putting this on and thanks for having us. This takes a lot of work. We understand it, and we really appreciate what you've done and for thinking of us and inviting us. And we're in great company here, so I feel pretty privileged. I've worked at the health department for a couple decades, and between Tacoma-Pierce County Health and Kitsap, done everything from kind of solid waste code enforcement to various waste management oversight. And then I spent the bulk of my career doing contaminated site investigation and cleanup oversight, and that encompassed many things, including sites that pose risk to residential and office settings, leaks from underground fuel tanks and solvent leaks. And it also included drug labs and drug lab response and properties that were impacted from illicit drug manufacture and use. And so I've personally and professionally seen through code enforcement and investigation work leading up to my current role in our social, economic, and environmental conditions for health program, excuse the long name, just a lot of conditions firsthand throughout the county, throughout Pierce County, Tacoma, and the various cities of pretty substandard conditions and how that impacts folks, and have since gained an appreciation for just what the disparate health outcomes can be from that. And the team that I work with has also, we also have a long history of looking at these conditions among many others, other kind of built environment factors that can either produce better health outcomes or that can restrict those and produce, you know, worse health outcomes. Housing, of course, is one of those. And we have an existing program here. It's a smoke-free housing registry, and I'll just mention this briefly, and we're building off of this as kind of a launching point. But we were so honored to have hundreds of properties currently registered. So these are landlords and property managers that had the foresight and the vision to cooperate and coordinate with our office to adopt various levels of smoke-free policies on their properties. These could be anything from, no smoking anywhere on the property to no smoking in common areas, or, if there's recreational areas and pools or common corridors, all the way to no smoking in any of the rooms or anything like that. And so, so long as they had these policies, we put them on a registry, and those registries could be searched by folks that are looking for housing, that are interested in having better housing accommodations and more healthy atmospheres specific to non-smoking. And so we had that for many years, and we were, and we've worked with folks, large property management entities such as Tacoma Housing Authority, to, smaller individual ones that just have, small apartment buildings and everything in between. And we did that with great success, and it's something our office is really proud of. And, but we don't want to stop there. We hear, and a lot of other government agencies hear this. Pierce County hears this, City of Tacoma, Fife, Puyallup, all of them get complaints from folks who aren't really sure how to remedy conditions that maybe their property managers or landlords are unfamiliar with how to bring a remedy to things such as mold, pests, and I mentioned smoking, but those three, they're kind of the trinity of the most common housing condition complaints that we get. And from our understanding, with comparing notes with other agencies, that's what they see from talking with other entities, such as Affordable Housing Consortium, and then Tacoma Housing Authority, and others. They also agree that those are kind of the top three ones that if we were to have a way to help mitigate pests, mold, and smoking, that would be kind of a lion's share of some of the substandard housing conditions that are, impactful to tenants in a negative way. So we want to expand our smoke-free housing registry to a healthy housing registry. And we, as a starting point, we're going to have those three criteria as kind of starting eligibility. And we want this to be really easy entry. We are developing boilerplate plans for pest management, for mold management. And we're talking everything from prevention to identification to remediation. So the whole thing. And so, if folks don't have those plans, we don't want them to hold them up from eligibility for joining. So we have those in place, and we just ask that folks have those plans, abide by them, and agree to join our registry. And in return, we're going to advertise for you where you are. We've developed a GIS mapping system. Think of this kind of like your favored Zillow or other kind of real estate mapping, where you can look by zip code or address, or just click and zoom in anywhere in the county. And you'll see properties that are on our healthy housing registry that is being developed now, and make choices. And so hopefully the property owners and managers will see, some economic benefit of doing that. But at the end of the day, what we want to do is help influence normalization of mold, pests, and smoking policy across our rental properties in Pierce County. Right now, that's unfortunately not normalized in many areas, and there's a lot of property owners and landlords and property management firms that do it right, and we want that to continue, and we want that to become more, widely expected from not only the prospective renters that come here, but current renters as well. Casey, I think you mentioned some of this already, about just what some of these health outcomes can be if we have substandard housing conditions, and that can worsen asthma. That creates times where students miss school. If they miss school, they're behind. There's some of these cascading effects, medical expenses that a lot of tenants just cannot afford. Housing stability is a big one. If you don't have housing stability, a lot of other things are really kind of dependent on that. Secondhand smoke, we know, we're familiar with how that impacts folks. Mold and pests, there's just a long list of preventable negative health consequences that if we are successful in normalizing better practices at more rental properties, we hope to see better health outcomes. And really, at the end of the day, that's what the health department's in the business of doing, is promoting things that increase better health outcomes and trying to remedy things that don't have good health outcomes. I could probably benefit from some prompting if you have some other questions for me, but that's kind of some of the broader points here of our registry and what we're trying to accomplish. I'll flip down to another slide here that highlights some of these things.
I have a quick question, because you were just talking about, the registry and, what people are seeing and hearing from tenants and things is how do you address those mold problems, pest problems, and that sort of thing? Whose responsibility is it? Who enforces it? So I guess that's my question. Can you explain a little bit about the health department's role in the enforcement of healthy housing? Who should residents speak to? Do you guys get those kinds of calls, and who do you transfer them to? If you transfer them, like what's the protocol for that, and how are you guys involved?
Right, great question. Thanks for asking it. I probably skipped right ahead to some of our remedy speak. So unfortunately, there's not a whole lot of oversight beyond basic building code for rental properties. And basic building code is, is the electrical safe? Is there a roof? Can it be heated to a certain, number of degrees at a certain number of feet above the floor? All of these things that make it just bare minimum safe to build and construct and permit the site in the first place. But in most instances, there is no regulatory framework or local code or state law that requires minimum healthy housing standards be demonstrable in these places, in these rental properties. So for instance, mold is a good one. There is not a code on the books that says you can't have mold in a rental property. So if a tenant were to live in an environment where there is mold, there really is no lawful remedy at play here. They're hoping that the landlord and the property manager will do the right and the healthy thing and resolve that. And many of our great landlord and property managers do, but not all. And there's plenty that don't. And we see that every day. So in lieu of having a regulatory framework to step in and resolve these things and have like, a code enforcement office or even local code authority from the health department, which we do not have, by the way. So I should probably make that clear. We do not have code authority to intervene and follow up on complaints and calls and investigate and require remedy when we find mold or pests or smoking or any other kind of non-healthful situation, with the exception of methamphetamine and some other drug use, but in very specific circumstances. There's some jurisdictions that are starting to get their feet wet there. City of Lakewood, I want to highlight them and champion them. They do have a rental property inspection program. And they are looking at things that go beyond basic building code. And I am unsure if they include things like mold and some other particulars, so I will have to beg forgiveness there. I'm not expert in all of their criteria. But that's a great model, and it's one that we would like to see elsewhere. But the here and now, though, is that there is not a lawful framework, and the health department does not have authority to come in and compel that. So, what we're hoping to do is normalize best practices through this voluntary effort and promoting properties that do it right, and hopefully having some influence, across the rental landscape. I think the more that tenants see that this is normalized, the more that they'll expect it going into it, and it won't even be, a second guess for property managers and landlords to ensure that their interior conditions meet these base level standards. That's our hope anyway.
Very good. Thank you. I mean, habit forming and habit control is kind of it's contagious, and that's so a bit of a gap there, but you guys are in the right direction, obviously trying to do what you can with what you're allotted to do. That's incredible. We have a
Right.
couple of questions, I think, about the registry in the chat. Well, ventilation, filtration, filter changes, carbon monoxide gas leak, kind of things be included, as well as plumbing, sewage, roof leaks, gutters, those kinds of things. Are those going to be included in the registry?
Not at first. Now we're going to promote, once folks are in this registry, we're hoping that we have a good conduit of communication to help share and promote other best practices that include those things. There is a nationally recognized healthy housing standards. And if anybody Googles those terms, they're going to find it. And that is a very long list of conditions that are optimum for best health outcomes. We don't want to put such a high barrier to entry here that we have, 99 different criteria that we want people to make before they're in the registry. We want to maybe just tackle the most common and maybe some of the more consequential conditions first. So like I said, mold, pests, smoking, we want to start there, but we're not ending there, but that's where we want to start. And I'm sure that there's going to be future registrants that come in that can show that they're providing great housing, and they include all those things that you had mentioned there. And so we're going to be promoting that, but we're not starting with those as minimum criteria, because we want lots of people coming in the door and getting their feet wet with this notion of partnering with the health department and helping us normalize some of these base level ones. And of course, the sky is the limit from there for how much they can improve and demonstrate.
Okay, we have, so I know, Jay says, I know there are issues across Pierce County with the lack of maintenance ability over the pandemic. There has been, this, ongoing issues. Does the registry work on fixing if those neglect issues?
Well,
lack of maintenance.
Right. Well, we want to certainly promote properties that are committed to doing that. And so, a lot of this is going to be good faith effort and partnership. And I want to emphasize this is voluntary. So we're, the health department, we're not necessarily going to be policing these things. We certainly want some base level demonstration that properties are doing what they've committed to. So we're going to do that. The other thing that I'm reminded of, though, is that we do understand that not all property conditions are solely the purview of a landlord or a property manager, that interior conditions can be improved by the tenants. And there's best practices that we intend to share with them too. And so we're hoping that these property managers, landlords, and property management firms, once they're on our registry, that they are okay with us sharing information with tenants too on on what they can do to keep their property up to snuff. We do recognize that, you can be the best landlord and have the best property management techniques in play, but there might be a tenant that is creating conditions inside of their unit that are unhealthy, and that there's not a whole lot the property manager can do. So we recognize that, and we are going to be tackling this from a couple different directions, what we can do on the property management side, but also what the tenants can do themselves. And we've got a lot of practice with that. We are close collaborators with Puget Sound Asthma Coalition that has a lot of members that are active in looking out for and decreasing levels of asthma, and helping folks, tenants and property owners alike, adopt practices that minimize things that exacerbate asthma and other kind of airborne illness. So, but yeah, both tenants and property managers and owners are going to have tools at their disposal, hopefully with our help through the registry.
Yeah, did you see the follow-up? Jay says I'm referring to when management companies are using the pandemic to not do maintenance. Specifically.
Right.
Yeah.
So if there's an example property that kind of falls into that, and they're not doing maintenance and it's creating conditions that are not conducive to great health outcomes, we want them to come and join the registry and improve those things. And like I said, that's going to be voluntary. If a property like that is not interested in joining our registry, or they, are not open to our overtures in doing so, and we're aware through, complaints or other things about conditions on their site that are not conducive to health, I don't have a remedy for that to offer you today, because we don't have code authority to intervene on that, sadly. So maybe there will be a day, and I hope that day is sooner than later, that there is code authority to intervene on those things. Or, if it's in the city of Lakewood, that their rental property inspection program can intervene and see to it that those things are turned around for the better. But I know that that's probably not the most satisfactory answer, but that is the answer.
Thank you. Thank you for your question and your answer, Rob. I'm gonna ask one more quick question of Rob before we go to our next panelist, and then other questions that are trickling in. If they're directed at Rob, we'll take more questions after everybody's presented as well. So we will have more time for questions, but I see one more I don't want to move on because it's relevant. Can there be something visible required to be posted on entry doors, similar to food establishment and health inspector, I guess, posted words?
Right.
Yeah, because she's saying that often this is on the lease, and so the blame can be, and costs can be passed on to the tenant pretty easily in that way.
Well, as far as yeah, so restaurants that undergo health department inspection right now, you probably, any restaurant that you find in Pierce County, you're going to find a little tag, and it's going to have like a smiley face or a frowny face or somewhere in between that kind of represents how well they did. And so I think the question is, are we going to have something like that for rental properties? We are happy to provide and highlight properties that are in our registry voluntarily engaging with us, that commit to mold, pest, and anti-smoking policies at the start. And we want to promote those. So, we have a great communications office here that comes up with great designs. They were kind of award winning, and they were recognized during COVID-19 response for having great messaging and design work there. So we have that apparatus in place to help us do that and kind of reward properties. We do not have the enforcement authority or the legal authority, though, to kind of inspect sites that maybe don't want us there or aren't in the registry, and provide signage that represents our findings. So, we're not going to be able to do that. I'm not so sure if it's conducive to the atmosphere of trying to normalize through voluntary engagement with us. If we were to put tags on front office doors that showed, non-smiley face sort of findings of our inspection. You know, if a site is in our registry and they volunteer to do that and they want to do good work, and somehow along the way, you know, it comes to light some substandard conditions are there, we would be a resource to them to help improve that. But I don't think we would penalize that with signage. If we were a true code enforcement authority and had that sort of framework, then signage, or at least publicly available reporting on our findings or inspections, would be available. But that's not the reality that we're in right now. So I wouldn't be able to offer that.
Okay. Great. Thank you for your questions, everyone. This is great. Already getting off to a productive start here. Thank you so much, Rob.
Thank
We're
you.
gonna,
Really appreciate it.
yeah, that was great information. Registry sounds very, very cool. So we are gonna move right along here. We're gonna move on to Gabe Ash, Director of Housing and Homelessness Services for Catholic Community Services. So Rob, if you don't mind, yeah, there we go. And then Gabe, I believe you do have slides. You're welcome to
Yeah, thanks. Get
throw
to
them up
share
there
here.
and introduce yourself as if, you know, I just introduced you very briefly. So if you want to tell us more about yourself and what you do.
Yeah, thanks, Casey. My name's Gabe Ash, as you said. I'm the Director of Housing and Homeless Services for Catholic Community Services of Western Washington and the Southwest Washington region. So the area that I'm involved in supporting is our work in Pierce County down to Clark County, Vancouver area, and sort of those 13 counties in the Southwest Washington region. I'm supporting teams that are doing work serving people who either are currently experiencing homelessness or recently were experiencing homelessness and perhaps now are in one of our programs or housing programs. Tell you a little bit about Catholic Community Services here. So Catholic Community Services of Western Washington provides, well, it was established just over 100 years ago. In 1918, we have 2,633 units of affordable housing in Western Washington. We have 22 shelters for people experiencing homelessness, served over 600,000 meals last year and each year. We provided 16,000, almost 17,000 behavioral health services to families. We also provide many hours of in-home care services, and we have almost 4,000 employees. And there's a picture of some of our volunteers. We have some pretty amazing volunteers as well that help us do things, all sorts of things. And these volunteers here helped us cook some meals for people experiencing homelessness. I'm going to talk a little bit about medical respite specifically, which is one program or one service that we provide, as well as others throughout the state and the country. So medical respite is it's temporary care for people who are coming out of hospitals, who are not so ill that they need to be in a hospital setting, but they're too ill to be released back to homelessness. And so rather than have someone sort of languish in a hospital bed for longer than they need, and the cost of that is quite high, medical respite is a service where people can discharge to a setting. In our case, we have shelter settings where we have reserved beds for medical respite, where they can also get some other services and recover. If, say, I was releasing from a hospital and I'm a person with housing and some family, I might be able to just be released from my home or to my home, and perhaps my family might be able to provide care for me. But if I was a person experiencing homelessness and I have a bad wound that needs to be cared for, and I was released to the streets to unhoused an unhoused situation, then that would be really challenging to care for that wound in a safe and clean environment. And so medical respite is a service that addresses that need, and is also a big cost savings. Washington State, I think it was California, was the first state to add medical respite care as a Medicaid benefit. And now Washington State has that benefit as a statewide benefit. So eligible individuals in need of medical respite can have their insurance, Medicaid insurance, billed for that service by a licensed provider or an eligible provider. There's still some, it being a newer service to Washington State, there's still some bugs to kind of work through. There was part of a recent convening that the National Institute for Medical Respite Care convened in Washington State. Yeah, with a bunch of providers who are either providing medical care or medical respite care, or would like to. And those providers were discussing, it seems like the main challenge right now to becoming set up as a provider of medical respite care so that you can bill Medicaid and get reimbursed for providing that service is that the managed care organizations, they're the ones that administer the sort of the insurance and process those insurance claims through Medicaid or Medicaid services. Some of them are not aware that it's a state benefit. It's very hard to get set up with them so that you can get reimbursed for that. But we're hoping by convening state providers and also bringing in some the NIMARC, the National Institute for Medical Respite Care, hoping to help work through some of those bugs so that it can be a service that's more available throughout the state and can be more sustainable because it will be something that can be billed through Medicaid and not have to solely rely on funding from other sources like hospitals. Here's just I want to share a little bit of information about people we serve in housing and shelter. We serve many individuals in our housing programs that have come out of homelessness and are now in permanent supportive housing, which is a specific model intended for people coming out of homelessness who need extra care and maybe would not be an appropriate placement into market rate housing. They need some on-site support. But this just gives you a little bit of an example of how many health problems some of the people that we serve and people that are coming out of homelessness have. So some preliminary results from our survey respondents showed that over 50% reported they had high blood pressure, almost 40% reported emotional, nervous, or psychiatric problems. 35% reported arthritis, 28% reported heart problems, 26% reported eye problems like cataracts, etc. 23% reported neurological problems, 22% reported diabetes, and so on. 48% of the individuals that responded said they had had a fall in the last 12 months. And the average age was 56 years old. What we're seeing a big need for is having in-home care services to help people with their activities of daily living. People that have come out of homelessness are facing challenges with that. And so we've been working really closely with other division of Catholic Community Services that does that, as well as some other providers of in-home care to make sure that people have in-home support to help them maintain their housing. We also have identified that there's beyond permanent supportive housing, there is a certain slice of the population coming out of homelessness that really cannot be served at their specific level of need. There's a higher level of care that's needed that is somewhere between permanent supportive housing and maybe psychiatric hospitalization and or like a skilled nursing type of situation. Because when we have people that are currently maybe using medications for an opioid diagnosis, or they have behavioral challenges, we can't usually get placement into things like a skilled nursing home. And so what we've been talking to the state about is some kind of extra band of housing that we were initially calling complex care housing, where people, maybe the top 5% of need of people that are struggling in permanent supportive housing, could go and have an extra layer of support where they could be helped in maintaining their housing. The state passed in the budget some money to go towards researching that, and that research should conclude by the end of this calendar year. What we're seeing in our in our medical respite care, what we're seeing is people are recovering from wounds and infections, people with breathing issues, people that are coming out of the hospital that might have cancer and are still recovering and receiving treatment, heart conditions, etc. And they're able to recover in one of our medical respite programs. Here's a little bit about our medical respite work at Nativity House in Tacoma. Nativity House is, there's a lot that goes on in that building. Everything from, there's a permanent supportive housing on the first, or the top floor, top 3 floors. There's a day shelter, and then there's a general shelter. Some of those beds, 13 of those beds, we've reserved for medical respite. And those individuals are people that are referred to us through either from Virginia Mason Franciscan Health or Multicare. They can stay for 30 days. And during that time, we're providing case management, medication reminders, laundry, coordinating and making sure they get to their follow-up medical appointments. We're providing meals for them. And we have on-site medical care through CMAR. One of the challenges we face is within that 30 days, we're trying to help support them in getting through their acute medical crisis that they're just coming out of. But we're also working with them to try to find housing within those 30 days. And oftentimes we're unable to find housing due to the lack of affordable housing that would meet their needs within those 30 days. So sometimes we are able to place people into permanent housing. Other times we transfer them into our general population in the shelter and try to continue to work with them. And then we would open that medical respite bed for the next placement from the hospitals. Another example is in Olympia. The Drexel House program it has a small medical respite pilot that's currently in the first year, provides just 2 beds of medical respite. Same thing, they can stay for 30 days. People are referred into that program from Providence. And while they're there, they get services as well, like housing focused case management, connection and coordination, making sure they can get to their appointments that they have follow-up on. And part of the success of medical respite is when people are discharged just out into homelessness, they often are back to sort of that Maslow's hierarchy of needs and just sort of in survival mode and not necessarily able to focus on follow-up appointments that they need to get to, maybe with primary care or specialists, and then their health can worsen. And so medical respite helps kind of bridge that and make sure they're getting the care they need. And same thing we find in Olympia at Drexel House, challenging in those 30 days to find enough housing in the community to get people placed. Here's just a little bit about the connection between housing and health. So poor health can be one factor that can lead to a person becoming houseless. When people have some kind of health event and their family, they can miss out on work, lose their employment, which can lead to poverty and homelessness. But also when people become homeless, their health conditions that they may already have can become worse, or they might be experience new health conditions. Some of the reasons are people are exposed to weather. There's the stress of always trying to figure out where's a safe place to be, and they can be exposed to violence at a higher rate than housed individuals. They have inability to store their medications, and we see often that a small wound can turn into something big and become a chronic wound because people don't have access to hygiene services and keeping those areas clean and things like that. When people are housed, they're able to store their medications. It increases their ability to access appropriate health care, etc. And there's just a little graphic there that shows health conditions among individuals experiencing homelessness compared to the general U.S. population. And often like diabetes is twice as many people experiencing homelessness experience diabetes. Blood pressure is almost twice as high. Heart attacks as well, and so on. There's the references there, and I'll stop sharing my screen. And that is a little bit about medical respite.
There we go. Unmuting myself. Why is that the hardest thing on Zoom? Thank you, Gabe, so much. That was really, really helpful. Learn a little bit more about what you do and how y'all are doing it. I've got a lot of questions for you. I'm going to save most of them for the end. And so that we can get on to Tonia, I'm going to go ahead and move forward. I've got some questions that I'm going to save for Gabe. We've got some more time for everybody to ask questions of Tonia as well. Just want to keep everything as balanced as I can and make sure we get through all the questions and all the information and have as much discussion as we can. So I haven't forgotten about anybody that's put any questions in the chat, just so we know. And thank you so much, Gabe. That was great. All right, Ms. Tonia, Director of Housing and Care Management with Metropolitan Development Center. We are ready for you. So you don't have any slides. We've got some questions for you, though.
Hi, Casey, thank you for having us. I do have Victoria Chittenden here with me, and she's kind of hiding off camera.
Hi, Victoria. Thank you for being here as well.
So
Yeah.
we do work as a team here. So we're taking this as a team approach as to what we do here at MDC. I'm going to start by saying we are Metropolitan Development Council. I am Tonia Hess. I'm the Director of Care Management and Housing. We are now in our 60th year of providing community service. We are a community action agency. Who am I? I came to this organization as a withdrawal management nurse. I stayed in withdrawal management for about 15 years before moving on to the housing side. That decision didn't come lightly, but it came with the insight that housing and healthcare go together. And I needed to see it work together because I was seeing a recidivism in withdrawal management where they came in, they worked hard, they did their part, and I released them to homelessness and they went back to what they knew. So they came back again. So we were looking at a way to bridge that gap, so to speak, to make sure that we were not seeing anyone be unhoused in need of services if we could bring them together, seeing we provide both. So with that being said, I oversee our housing portfolio for MDC. We have affordable housing, low-income housing, and transitional housing. Under our care management, I oversee foundational community supports. I oversee our community-based rental assistance, as well as our PSH, permanent supportive housing. And that's for young adults and older adults as well. We currently have, we work with some developers and we provide services, community-based services to rental properties as well. But what we really want to focus on right now in this meeting is foundational community supports. And I'm going to bring Victoria in on this portion of it. But before I do that, I want to talk about the health concerns. So who are our clients that we serve? We are primarily focused in the Pierce County area. We serve low income, no income individuals, chronically homeless with disabilities or diagnosed disabilities, and young adults as well. Our health concerns. So as far as health concerns, what we are seeing is the challenge with mental illness when it comes to housing, undiagnosed mental conditions due to chronic homelessness. What else would I say we're seeing? Substance use disorder, which is a big part of what we're seeing, and it is a barrier to housing for some, depending on if there are charges tied to it. But we as an organization work from a housing first principle. We firmly believe that housing comes first. Then we can work on those barriers that are creating the person from moving forward in life. So with that being said, we're going to talk about how foundational community support has totally impacted our organization. And I'm going to pass that off to Victoria.
Hello, my name is Victoria Chittenden. I'm the manager of care coordination here at MDC. So FCS is a targeted Medicaid benefit that helps eligible clients with complex needs obtain and maintain their housing. As a team, the FCS team here at MDC, we provide ongoing services and supports to approved FCS participants, which include housing assessments, identification and goal planning around identified barriers, connection to needed services such as medical providers, mental health providers, substance use treatments, as well as education and employment services. So we really do wraparound services to make sure the whole person is seen and we lift them up to reach their goals. We also take part in identification of connection to housing resources and support with understanding and signing of lease agreements and the development of relationships with landlords. So we take an active role with the participant in developing relationship with landlords. So that way, if there is a situation and the client needs support, we already have that established relationship with landlords and we can really go in on their behalf and try to save their housing if we're in a situation where that might be at risk. We also really focus on the development of independent living skills, helping them, if they don't know how to maybe wash a load of clothes because they've been homeless, let us show you how to do that. So then that way you can do it on your own moving forward. And then crisis management. If there's crises going on, we are there to support the participants through that. We don't just, oh, you'll be fine. No, we actually show up and we walk through it with them. So MDC has a really, really strong partnership with the HCA and has been an FCS provider since 2018 when FCS was a pilot program. HCA has provided strong support, which has allowed us to be able to take a really active role in the community with our participants. And when we need services or supports from them, they have always been super responsive and extremely helpful with what we're doing. Some data for you guys is, so since 2018, we have served approximately 700 individuals and families in the FCS program. Currently, right now in 2024, we have 274 participants. 174 of them are currently housed, and 159 have been housed for over 180 days. And the 100 that are still seeking housing, we are actively working on the identified barriers that they have identified through their goal and service plan, and we're walking with them through that. So it's not, oh, you need to, get your social security corrected, go ahead and go do that. No, we actually take them to those appointments, and we sit there and we walk them through it so they're not being lost in what's going on, because that can happen surprisingly easy. So
someone access the program.
So in order for participants to access the program, MDC offers a housing resource group every Tuesday from 12 to 2, where they can just come in. Care coordinators are here waiting for them, so they can access the services that they need. Even if it's not housing services that they're looking for, we can connect them to the other services that we offer here at MDC. They can also connect with us through our website, or they can come straight in and come to our Welcome Center and let the staff at the Welcome Center, know that they need services, and they will reach out to the appropriate team within MDC to get them what they need. There is a no wrong door approach here. So no matter where they go to start with, we can connect them through all of our services.
I have a quick question for you on this. Is the FCS a waiver to be used to pay rent, like a voucher, or is it just for medical, or what? Can you describe that a little bit?
So the FCS program itself, the main program, is a non-tangible benefit. It is all support. However, those who have been approved for FCS also have the ability to tap into something called FCS TAPS, which is a small pocket of funds that they can use to pay rent, pay utilities, things that are barriers for them in maintaining their housing or even getting into housing. So if they need funds to pay a deposit, FCS TAPS, we can apply for that and use that money to help them pay that portion of their move-in costs.
And do you have any services outside of Tacoma? Like gig hardware or Spanaway?
We serve Pierce County.
Okay.
Yep.
So how has it been? So the way we see that it's been helpful for Pierce County, we have seen lots of families who were in danger of losing their housing, maintain their housing. We found that in some cases it was that they needed those additional supports. They were housed, they were on the cusp of losing housing due to just various challenges that they had with being housed after not being housed for an extended period of time. It allowed us to be able to go in, provide those case management services along with landlord eviction prevention. So we were able to sit down with the landlord with them and come up with an eviction prevention plan to help them maintain that housing and maybe change some behaviors that was endangering the housing. So we found that this program really opened up a lot of doors for our clients and also with the landlords. It gave us the opportunity to share with them that, hey, especially during the pandemic, that there's additional funds out there, that your tenants could possibly use to pay off their back rents. they may not be aware of it. So let's, inform the landlords as well as informing the tenants. So that was another aspect that we found helpful with FCS. And I do want to talk about 4, why or how housing and healthcare are interconnected. I'm going to speak from the nurse part of me now. The nurse in me says that you can't have one without the other. It's impossible to maintain that balance. If the person is homeless, their focus is not on their health. It is on their shelter. Where am I going to be next? So now we have ERs flooded with diabetes, just you name it, all kind of physical health conditions. This is just not a workable plan. They have to be together. Healthcare is, housing. Housing is healthcare. They are one. So I don't see no other way to put that. That you can't have one without the other. There's your connection.
Simply put and very well stated.
Uh,
Can you tell me how many students do you see or process these housing options?
oof. So we have we work directly with Pierce College. So we have a care coordinator that go out to Pierce College and work with the students, the college students. So I want to say, about how many do you think Kyle had? At least, I want to say 100 plus.
Yeah,
Yeah,
he touched quite a few.
Yeah, we're going to say 100 plus. Because we are located at the college sites as well. And we are, because we're integrated, and that goes back to our no wrong door, our education team makes referrals for students at the sites that they are at as well. So it's not just the student, it's of course the family. So I would say more than 100, or more than 100 plus.
Okay, and would it be possible, it looks like Samara is interested in getting a care coordinator at UWT. Are you guys involved there?
We are not at UWT, but we are everywhere, but we can be.
How about I connect you two?
That would be great.
I'm happy to do that. And then, yeah, what other kinds of things are you guys doing in terms of permanent supportive housing? And you spoke to it a little bit, but I wonder if there's more to speak on.
So as far as our permanent supportive housing, we have permanent supportive housing that we work with through Pierce County. We also have permanent supportive, and let me slow down, permanent supportive housing through grants with Pierce County. So we have several projects that are permanent supportive housing. We also work with Pierce County Housing Authority as well as Tacoma Housing Authority. So we have project-based units within our MDC properties that are supportive housing, but they are permanent supportive housing. So once they are housed, we continue to work with them to make sure that they are obtaining their goals. If their goal is to move on to owning their own house someday. So we want to make sure that we are not, missing that opportunity. And that we're engaging our tenants in our MDC owned units as well. What other permanent supportive housing? I want to make sure I touch them all. So we do have what other sites? We do have permanent supportive housing that are that were formerly homeless. And they transitioned into our MDC permanent supportive housing. And within that group, we still provide those continued services. But throughout our whole portfolio, all of our tenants have access to services. We take our services to our clients or our tenants. We go out to those sites and provide those services. And it's free of cost to our tenants, of course, if they want to engage. It's not mandatory that they engage, but we like to make sure that we're keeping them in the mainstream, that they're understanding that, hey, there's different opportunities that they may not be aware of. We try and take trainings to the sites. We work with some developers in their properties, and we take our services to those sites as well. It's permanent housing for them, but for us, it's making sure that even though the individuals are in those permanent housing that are not managed by MDC, that we are still a partner in the community and that we are there to provide those services. Should they want the services, we work with our community partners as well, because you can't be the be all end all. So we make sure that we're who does it best. We want to make sure that we're connecting to that organization to bring them along with us to provide those services as well in permanent housing. So that's
Thank you.
education, employment, and all of it.
You guys are connectors, and yeah, you guys are right in the middle of it.
In the thick.
And that's why we work with you guys, because we're all connecting each other.
Yes.
I wanted to ask you, I'm gonna ask you one more question, and then we'll move on to like big group discussion, lots of audience questions. But I wanted to ask you, because we're doing the walking tour tomorrow. We're gonna go by the Hilltop Lofts. Can you talk about that project a little bit in Hilltop?
I can. So Hilltop Loft is a 57 unit permanent supportive housing. We are partnered with, we're partnered with FPI, THA, and Horizon. It is a blend of chronically homeless individuals with diagnosed disability, as well as chronic mental illness. So the project is kind of divided up into a certain number of units to cover all aspects of those categories. It is a 24-hour program manned with peer staff as well as case management. Am I missing anything about the Hilltop Loft? It's a beautiful building, I may add. It opened in October of 2023. And it's normally at capacity. I think they may have one open space, but it's pending someone moving in at this time. They have different activities that are worked on with the staff. It's not program focused, it's housing first. So they make sure that that they're respecting boundaries and its services aren't forced. So they're working with, just basic skills when requested. They help with application processes, just community engagement. They do a lot of skill building and a lot of re-engaging, basically, karaoke, that kind of stuff. Anything to bring them back to what one would say is a happier place for them to move on in the services.
Wonderful. Perfect. I thank you very much, both of you, for answering my questions and explaining what you guys do. I mean, you are right in the middle of it.
Thank you for having us.
Absolutely. Thanks, Victoria. Yeah, we've got plenty of time for some extra questions. Anybody in the room that has questions, feel free to throw them in the chat. Whoever raises their hand, if you raise your hand, I might call on you first so we get a little bit of discussion going. But then I will read chat questions as well and go back to the ones that I missed before. I'll give a couple moments for people to get their questions. And if you do have a question, just feel free to come off mute. I'm going back in chat to try to find the questions that we missed.
Hey Casey, it's Amanda. I'll just go really quick while you're scanning the chat for questions. I actually following up with you, Tonia. Is the long-term goal for residents that are in permanent supportive housing to transition out and free up some of those units for folks maybe coming out of respite care? We talk a lot about the need for permanent supportive housing units, and they're often the most hard and expensive to develop. I'm wondering what that kind of continuum looks like for somebody that's, experiencing homelessness and goes maybe into respite care or not, and then into permanent supportive housing.
So with permanent supportive housing, it is just that, permanent supportive housing. However, when we speak to permanent supportive housing, we want to make sure that they understand that it does not have to be permanent. So if the individual is wanting to, and we support, moving on into the community and not feeling like you need to stay in what most of project-based, that you don't have to stay in project-based housing. Foundational community support allows for that opportunity, because most of the fear that we found in permanent supportive housing is that they are afraid to move on and not have that support. So now that they have that community-based support, we have found that lots have applied for vouchers, move-on vouchers. We've seen a lot of that in the last month, I want to say the last year, where we've seen at least 30 or more, 30 or more individuals that were in permanent supportive housing choosing to move on into the community, knowing that they have that community-based support now. Yes, I see permanent supportive housing as a start point for some, and we teach to that. Yes, there are some that may not ever be able to move out of permanent supportive housing, given certain conditions, but then there are a lot that are choosing to move out of permanent supportive housing now that there are more options. And so we look at that as freeing up additional space to bring in new participants. So yes, I see that happening now, more so in our young adults that were in permanent supportive housing. I would like to say out of 14, I want to say just in the last 2 months, we've probably had 6 that applied for vouchers to move on out into the community with continued supports. So yes, it is, even though it says permanent, we let them know that it does not have to be permanent. And they're taking us up on it. A lot of them are taking us up on it now.
That's great. I'm going to go back really quick. I see Jay, you have your hand up, but I'm going to ask a question that you put in the chat a little bit earlier. I think this was for Gabe. Many places that Jay advocates for they are looking at affordable housing as 80% AMI. How necessary do you feel it is for others to shift towards 30%?
I could just say that, I think 30% is in Pierce County, 22,600 or something like that for a single individual. And so I'd say most of the people that we are serving through medical respite would be in need of that because their income is that level or lower. So I could just speak for the people that we serve. That's sort of the level, that 30% or below is what our population tends to need.
Great. And it looks like Jay was actually meaning to pose that question to everyone, 30% and lower. Does anybody else have anything to respond to that with?
I can respond to that. We currently have a lot of 30% AMIs in our housing projects. And we find that because a large portion of the individuals that we serve are on fixed incomes, is there a need for more 30% housing? I would say there is. 80%, I'm not seeing a lot of 80% income AMIs in the group that we serve.
Okay. Thank you for that. Did we have another hand up? Did we get our question answered? Feel free to throw your hand back up if you still got a question. Yeah, go ahead.
Hi, my name is Dawa Goes Behind. I'm the Executive Director of Pierce County Community Land Trust. I had a question about the vouchers. We provide affordable home ownership options, usually around 60% and lower for individuals. Can those vouchers be used for down payment assistance for home ownership options?
Yeah, anybody who is willing and able to answer that is just take yourself off mute. So awesome. We might have to get back to you on that. And I don't know, Rob, did you just unmute yourself?
Only to fill the pause there, with apology, the health department doesn't have a whole lot of intersection with vouchers or home ownership programs. So I'd be very interested in the answer to that too, just so, if we know the answer, we could convey that to folks that might come to us asking assistance.
Okay, thank you. Thank you for your question too. Carrie says, we know that seniors are currently the fastest growing homeless population. How are current models changing to address near elderly, baby boomers, etc., and preparing for Gen X?
Yeah, I think part of just in my little corner of the world, that's part of we have a focused committee on sort of this issue of, as we're seeing the populations we're serving aging, that's part of why we did that survey that I talked about, where we're seeing almost half of the individuals in our permanent supportive housing are reporting that they've had a fall in the last year. And so trying to assess the need and trying to do some new ways of partnering with getting in-home care to people, doing some work to try to pilot presumed eligibility and things like that to speed up the process for people getting in-home care that would help them with their activities of daily living. That's one thing we're seeing as a need, is that population's aging.
Thank you, Gabe. Do any other panelists want to speak to that? All right, Jay's got another question. Go ahead, Jay.
I'm sorry, I ask a lot of questions. I'm really, really bad about that. So with experience of being homeless, one of the things that I face, and I've been housed for 10 years now, is I still have rudimentary issues with habits and things that I have from being homeless that are carryover. Do you guys have programs for people that like found housing on their own, but still need help working on getting out of those crisis points and figuring things out later at a certain stage when they're looking for the help?
That is one of the bases of foundational community supports. We not only work with individuals who are currently homeless, but we also work with individuals who are housed, who still meet those criteria and need those additional supports to maintain their housing stability and to work on those barriers that are still triggering them once they are housed. So yes, we do provide those services here at MDC, and we created that's why one of the points for creating our housing support group is to make sure that we're not only supporting the ones who were previously unhoused, but the ones that are currently housed and are still having just those everyday challenges from previously being unhoused. So we do host that group on Tuesdays from noon, every Tuesday from noon to 2 p.m. And it's just a walk in and meeting with a care coordinator and just, hashing out those possible barriers that you feel need to be addressed.
Thank you.
And I just added in the chat, Jay, Sound Outreach offers free budgeting support. I don't know if that's something that you'd be interested in, but I think they offer really great services. They're really, really nice people, offer it for free, working on financial security for people in whatever capacity you need them. So that's a really cool resource, and it's just in Hilltop on MLK, right next to the community health center. Go ahead, Mark.
On that, I work with Associated Ministries on the rental readiness certification, and we do 3 sections. One is landlord tenant law, which I lead, and then there's the finance one that you were just talking about. That they do a great program that is free of cost, and it's really knowledgeable. They go through real live, well, not live, but they go through the actual numbers of doing a budget, doing expenses, seeing shortfalls, and how to live or exist with what you got so that you can look forward to. It's a great program. My question is, or not question, but I guess awareness is both for CCS and MDC is that, so I am a housing provider and a management company, and we manage over 1,000 homes in the Tacoma-Pierce County area. And one of the greatest frustrations we have, which also MDC has too, and also the rapid rehousing programs, is that we see families come through the program of rapid rehousing that we've already worked with before because they didn't get enough or any assistance to maintain housing. And so what happens is this family is no longer supported by whatever program that they were on, and they don't have the resources to pay the rent. And then we have to start the process of the eviction. And it's really unfortunate that we have a large funded staff, well, it's still not staffed or funded enough, I get, on the housing side, but it's only minuscule as compared when you have the sustainable side. And so then for those of you that may not know this, is that the family goes out of housing and into homelessness, and now they're back into the rapid rehousing program where the caseworker is like, what happened? Well, this, and this happened. So again, through that program they go with all those resources, with all those costs that would only be of half if they were to sustain the housing. And I know that takes a partnership between the housing provider, the occupant, the family, and also the assistance program. But it's really frustrating for all parties to see a family cycle through the program again in less than a 2-year period. So, I'm not looking for an answer. I'm just sharing information that would be great to come up with. How do we direct funds? How do we get more funds? How do we staff up to do, like you were saying, the wraparound or the total support program, that just that one area where they're behind in rent on month 1, and we're already starting the conversation so that we can quickly get them sustained. And that would do a huge adjustment to the homelessness program for those that are on the border, maybe even 50 to 60 AMI. And then still keep room to focus on the 20, 30, 40 AMI. So that's just a missing that I see from this side that obviously, Tonia, you're shaking your head. So
Thank you for that, Mark. We always appreciate your perspective. I think we've got time for maybe one, maybe two more questions. I've got one in the chat from Carrie, saying there's also many models lean on Medicare, Medicaid eligibility. What about those who make just too much to be eligible? And where to go? Just eligible for Medicaid, Medicare? Is that the question, Carrie? Do you want to reiterate the question? I'm probably not asking it right.
We see a lot of people that aren't eligible for services, especially a lot of things more geared towards medical or like Medicaid eligibility dependent. But then people have spend downs or they're just above that amount because the average Social Security benefit is closer to like $1,500, $1,700 a month, which is over the cutoff line. So how do we get services, the same ones that we have for Medicaid eligible, to also help Medicare eligible, and especially things that a lot of older people have trouble with, and disabled people too, like housekeeping is not included, but you can get like an in-home nurse or physical therapy or something like that. But just those basic activities of daily living that a lot of people fall through the cracks or fail inspections or things like that because they're not getting just basic like chore services, or moving help is a big one too. If somebody needs to move, then there's not much assistance available.
Yeah, any of our panelists want to speak to that? And if we can't speak to it, that's okay too. That just means that we have more conversations to
Oh,
have.
Yes, and we were
ahead.
sitting here brainstorming on that one because we do know that we offer community-based rental assistance, the CBER program through it's Commerce funding, but it's still a behavioral health program. So the restrictions aren't as stringent as the FCS participant program. However, there's a wait list. So but it's not Medicaid focused. So that makes it a little bit easier for someone that's trying to get those additional supports. I can't think of anything else right off the top of my head. But of course, the traditional rental assistance programs that are out there. And just brainstorming with the case manager to see what's available. We do, during our housing group, we do go through all the non-traditional routes. So we look to churches, we look to wherever there's resources, large Microsoft, Wells Fargo. So we look wherever there's anyone offering those type of benefits. All I could add to that one. Wish there was more.
Absolutely. Thank you so much. We are currently out of our time for questions, and but we do, I think, have a note from the Affordable Housing Consortium Board President, Mark Melsness. Take it away, Mark.
Thanks, Casey. Hey, just a quick reminder, you guys can get out of here after this, but Thursday afternoon or evening is our reception. It is really going to be a great opportunity for you to continue this conversation with other people in the face-to-face, the real world, right? And your support would be greatly appreciated by the executive team here with Amanda and Casey. They've worked very hard for this whole week and all the events that are planned, like the one that we're on, especially this reception that we're having. You'll get a chance to also, bend the ear of the board members and even mine, if that's what is worth it for you to be there. Please check your calendars. Did we put the link for the tickets in here, Amanda?
Yep. We've
Okay,
got the
great.
link to get tickets. If you need a little bit of financial support for the tickets, just reach out to us. My and Amanda's emails are both in the chat as well. Thanks so much, Mark. This is also an opportunity to have a chance to meet some of these panelists throughout the week. We've got 6 panels. about 15 to 17 panelists, lots of professionals in this space and individuals just looking to network and learn more. So it's gonna be a really great in-person. There's gonna be food, drinks, that kind of stuff. So I encourage you to join us and reach out if you have any questions about joining us. Huge thank you to our honored guests today. We thank you so much for your expertise, your dedication to the intersection of housing and public health. I apologize, we're over a couple of minutes, but I appreciate those of you that are still with us. This was a really productive conversation. Obviously, we need to continue to have it. And I hope that we do. I hope that you continue to engage with this topic, reach out to us with resources, questions. We can connect you to the appropriate entities. And yeah, this is what we do. We just talk about the importance of housing and intersections. So thank you for being here for that. Yep, and as I mentioned, we're going to be sending out the recording for this. Samara, just let me know that if you go to the chat at the very top where it says healthy homes, healthy communities, there's 3 dots. You can save the chat on your own computer. You don't have to wait for me to send it out. I had no idea. So thank you for that. Amanda's right, the more you know. And just a final, we have 2 opportunities for panels tomorrow. We have 2 panels tomorrow. One's at 9 a.m. It's going to be focused on racial and social justice. And then there's another one at noon that's going to be focused on Black home ownership. I encourage you to join us for one or both of those. It's going to be great conversations, great panelists as well. Yeah, we are just thankful that you're here and engaging in these topics. Thank you again to our panelists. This conversation wouldn't have been a conversation at all if it wasn't for everyone in this room, especially our panelists and your information that you shared today. So wouldn't have been a discussion without you. So thank you so much. I appreciate everybody for being here and hope to see you next time.
Thank you.
Yeah, thanks, Casey. Hey, Casey, can you hang on for a moment?
Sure.
While everybody goes back to their calendar.
Did you stop
And
the
Amanda?
recording? Hi.